Hello, my dear friends. I'm Dr. Vaishali Bharambe, Professor Anatomy. What is this nice boy doing running on the road? Probably Saturday morning jog. And why is this dog on the screen too? What do both of them have in common? Obviously, what is common is they both have a rib cage. They both have a thoracic wall, which is the topic for today, thoracic wall part 1. In which we will be discussing a typical intercostal space and related muscles. Right. So, let's introduce ourselves to the rib cage. This is the sternum. These are all the ribs, okay, first to 12th rib. And here in the middle is the costal cartilage. Come, let's look at it in the skeleton. So, as you can see, this is the rib cage, okay. So, let's count the ribs. First rib, second, third, fourth, fifth, sixth, seventh, eighth, ninth, 10th. And then going posteriorly, the 11th and the 12th. Okay. The sternum. Okay. And you can see these are not bones, right? These are costal cartilages. Okay. Now, here you are seeing a posterior view of the same rib cage. You can see that it extends from T1 to T12 with the associated ribs articulating with the vertebra, creating a rib cage. These are the intercostal spaces. Come, I'll show you this on the skeleton. Let's now study the rib cage posteriorly, starting from the T1 to the T12. Okay, so these are the vertebrae, thoracic 1 to thoracic 12, and these are the 12 ribs. As you can see, between two ribs there is a space. This space will be the intercostal space. Okay, so those are the spaces. Now, I'm going to just for a minute hold his hand. Okay, now take a look at these spaces. This is as viewed from the side. So you can see that the intercostal space is comparatively narrow posteriorly and becomes quite wide anteriorly. Okay, so from the side you have to understand the intercostal space from posteriorly and from anteriorly. Okay, come, let's now discuss on the video. Now you're looking at the same rib cage from the side. You can see that posteriorly the intercostal spaces are quite narrow and anteriorly quite wide. Obviously, the topic for today we are going into are the intercostal spaces. Each intercostal space will be discussed now along with the muscles. Later on, we will also be talking about arteries, veins and nerves in the intercostal space along with applied anatomy. So let's talk about intercostal space and muscles. For that, I want you to first understand a few points about the rib. Come, focus on the screen. This is the head of the rib, the neck of the rib, and the tubercle of the rib. And every rib, as it moves forward, shows a posterior angle and a groove along its inferior border called as the costal groove. You can see how the anterior end of the rib articulates with a costal cartilage in this manner. Okay, so I'm going to show you this on the rib. So in a rib, this is the head, the neck, okay, the tubercle, the posterior angle, and if you run your hand along the inferior border, you will be able to see a clear groove. It's quite well defined, okay, a well defined groove along the inferior border of the rib. Okay, if you look carefully now, you'll be able to see this groove. Can you see it? Okay, right. Come back to the screen now. So, knowing this is important. Come, I've taken a section of the rib now. This is the section of the rib. Can you see that there's a groove on the rib? This groove is called as the costal groove. It is situated along the inner surface of the lower border of any typical rib. Inner surface of lower border of any typical rib. Knowing costal groove is a very important part of our study of intercostal space. Come. So now here I am showing you a vertebra articulating with the rib. You can see that a ligament is attaching to the rib called the superior costotransverse ligament. Now this is a little difficult, but I want you to just note it. Now, here's the transverse. We are looking in the second image, we are looking from the front. So, thoracic vertebrae and the ribs articulating with it from the side. These are the transverse processes of thoracic vertebra. This is the superior costotransverse ligament having an anterior lamina and a posterior lamina. Okay. So, posteriorly, your ribs have a superior costotransverse ligament attached to them. Anterior lamina, posterior lamina. Just knowledge. Right. So, we will now, with this background, discuss intercostal spaces. Whenever we discuss something, we have a habit, we want to define it. What is intercostal space? Intercostal space between two ribs. Very simple. Intercostal space is a space between two adjacent ribs. Easy? Yes. So, define an intercostal space. How many intercostal spaces? What are the types of intercostal spaces? Which are typical intercostal spaces? These are some of the questions we are going to deal with now. So, let's first focus on definition, which is very important. Focus. Okay. So, typical intercostal space is a space between two typical ribs. That means all the atypical are gone. Okay. Third to ninth only are the ribs which are qualifying now. Spaces between these. Traversed by intercostal nerves and blood vessels. Read carefully, which are confined to the thoracic wall. So, only those are going to be typical whose contents are confined to the thoracic wall. I'll tell you why we are discussing this. Come on. So, presently we'll keep that information and move on. Intercostal spaces are of different types. Those which are vertebrosternal. From the vertebra to the sternum, the space is complete. Okay. Versus from the vertebra to the costal cartilage. Remember, vertebrosternal are first to sixth because all the first six ribs articulate with the sternum. 7th and 9th are vertebrochondral because anteriorly they do not articulate with the sternum but articulate with costal cartilages. And the last vertebral intercostal spaces because the ribs are floating. They don't have an anterior end which is attached to the thoracic cage at all. So, these intercostal spaces are open and they are vertebral intercostal spaces, 10th and 11th. So, let's continue our discussion with this back to typical and atypical. When is an intercostal space typical? When it is between adjacent ribs, the ribs have to be typical ribs and the contents do not extend beyond the thorax. This actually reduces the intercostal spaces. Typical ones are only 3rd, 4th, 5th, 6th. Why? Because the intercostal nerves and blood vessels of 7th, 8th, 8th to 9th, 9th, 10th all extend and go on to supply the abdominal wall. So, they are not limited to the thoracic cage and therefore are not typical intercostal spaces. I am going to leave this as a note. You can pause and read it again. Right. Question number 1. If you understood up till now, you should be able to answer. How many intercostal spaces are there? There are 11. Very nice. Name the typical ones. Yes, 3rd, 4th, 5th, 6th. If you are enjoying this, do please like, share and subscribe to my channel and hit that bell icon. Do visit my website vbanatomy.com for more detailed lectures, for more osteology lectures, surgical anatomy videos, histology drawing label videos and much more. You can also test your knowledge on the MCQs. Link is in the description section. Right. So, let's talk about the boundaries of an intercostal space. We know we can call it typical if it's 3rd, 4th, 5th, 6th. What are its boundaries? What is above in an intercostal space? What is below? Okay, come, let's understand. So, now I'm going to keep this image for you. Okay, this is upper rib, this is lower rib. And these are the muscles and blood vessels in that space. So, upper boundary is formed by the lower border of the upper rib and related costal cartilage. Lower boundary is formed by upper border of lower rib and related costal cartilage. Confusing? Come, take a look. This green image that you are seeing here, this green space is the intercostal space. It contains muscles, it contains blood vessels, it contains nerves. Everything in that is intercostal space. Clear? So, anterior end is formed by the sternum and costal cartilages. Posterior end is formed by the vertebrae as they articulate with the ribs. See here, this is the posterior end. Okay. Now, each intercostal space is directed downwards, forwards and medially. Remember, the rib is not horizontal, the rib is angulated. Therefore, the intercostal space is also angulated downwards and forwards. Width is narrow posteriorly, wide anteriorly, right? The widest intercostal space is at the costochondral junction. Each intercostal space, I want you to bring your mind to the intercostal space. It will have two parts. One part which is between ribs, one part which is between costal cartilages, right? So, two parts of intercostal space, interosseous between the two ribs, between the bones, intercartilaginous between the costal cartilages. Simple. So, enumerate the contents of intercostal space. I am sure you will be able to do this, but anyway I am going to give it to you. In an intercostal space, typically you have muscles, you have intercostal nerves, intercostal arteries, intercostal veins. So, that's the next thing we are going to study now. Okay. Today our focus will be on muscles. So, come. The intercostal muscles are external intercostal, internal intercostal and transversus thoracis. Transversus thoracis is divided into three parts: intercostalis intimi, sternocostalis. About so much of jargon, madam. Why do you want to give it to us? It's wrong. I should not have given you theory on the screen. Let's use a very pretty image to understand. We are starting with the external intercostal and the image will make you understand so easily. Just remember 2 points. External intercostal is membranous anteriorly. It forms the anterior intercostal membrane. Posteriorly, it fuses with the posterior layer of superior costotransverse ligament. Now, do you understand why I made you learn that ligament? Because the posterior lamina fuses with the external intercostal muscle. Now, here you are seeing a beautiful image. Okay. The image is showing you, this is your external intercostal, obviously externally situated, which is fleshy posteriorly and quite membranous anteriorly, forming an anterior intercostal membrane. This is a beautiful image of intercostal space and whole thoracic wall made up of skin, superficial fascia, serratus anterior, and finally external intercostal, attaching to the lower border of the upper rib and outer border of upper surface of the lower rib. Okay, extending from the upper rib to the lower rib, outer border of both. Okay, that's the external intercostal. Just for your information, I'm going to tell you all the rest of the structures here. This is the lung covered by the visceral pleura. This is the pleural cavity and the parietal pleura. Okay, you can also have endothoracic fascia here. Lining that now is the intercostalis intimi and internal intercostal. Okay, so external intercostal is related deep to all these structures. It would be wonderful if you can draw a diagram of thoracic chest wall and intercostal space with me. Come on, take your color pencils and let's begin a diagram. We'll first draw the vertebra. Okay, so here's your heart-shaped thoracic vertebra. Okay, the vertebral foramen, the transverse process, and the spinous process. Okay, so vertebra is now ready. Okay, now here in the front we are going to draw the sternum. Right, Now our job is to create the muscles. Okay, so let's take the first color for the muscles. Since it's a comparatively thicker muscles, let's take a bigger thickness. Remember, the muscle is quite fleshy behind and then becomes quite thin and membranous anteriorly. So as you come anteriorly, reduce the thickness of the pen, and here's the membrane. Okay, now a layer lying further medial to this would be the internal intercostal. As you recall, this is very fleshy anteriorly. Posteriorly, it becomes very membranous and fuses with the costotransverse ligament. So we're going to draw the costotransverse ligament in green. Okay. Now the innermost layer, again, if you remember, there are three sets to this layer: a subcostalis, intercostalis intimi, and the sternocostalis. Since they're supposed to be a single muscle, let's just join them up a little bit. Let's add the related blood vessels, internal thoracic artery, and the related internal thoracic vein. And there you have a very simple diagram showing you all the intercostal muscles of the thoracic wall. Now all we have to do is to color the bones. So that's your vertebra colored, that's your sternum. Just for the fun of doing the diagram, let's just add a little bit of character to this bone. Here too. And there your diagram, very simple diagram of intercostal muscles is ready. Having understood this, let's go on to talk about the internal intercostal muscle. This is special because anteriorly it's related to the sternum. Posteriorly, it forms a membrane called posterior intercostal membrane, and then it's continuous with the anterior lamina or superior costotransverse ligament. So again, the same image that you've drawn this, so you're going to find this very easy now. Here is your internal intercostal, anteriorly fleshy, posteriorly becomes a membrane, posterior intercostal membrane, which continues medially with the anterior lamina of superior costotransverse ligament. Okay, so that's the internal intercostal. Again, coming back to our favorite diagram, here's your internal intercostal related superficially to the external and deep to the intercostalis intimi. It takes origin from the floor of the costal groove from the upper rib to the middle of the upper border of the lower rib. Now this is all a lot of talking. You see it and you describe it. Don't try to remember the words I spoke. It's difficult to remember. But you look at it and it is self-explanatory. Okay. So let's talk about the last muscle, the intercostalis intimi. Again, using your own diagram. This is transversus thoracis, made up of three muscles: subcostalis, intercostalis intimi, sternocostalis. It is the intercostalis intimi here which we want to focus on. Between this and the internal intercostal, blood vessels and nerves travel, creating a neurovascular plane. This is the plane in which we find the contents intercostal nerves and vessels. So here's your intercostalis intimi, and this space here is the intermuscular space through which intercostal nerves and vessels travel. The intercostalis intimi takes origin from the upper end of the costal groove to the medialmost part of the upper border of the lower rib. Now let's talk about direction of fibers. As you see, the external intercostal fibers are directed downwards and medially, anteriorly, downwards and laterally, posteriorly. Okay, just grip your thoracic cage like this and you will get the fibers. The internal intercostal and intercostalis intimi are perpendicular to this, directed downwards and laterally anteriorly, and downwards and medially posteriorly. Intercostalis intimi lies parallel to internal intercostal fibers. Now here let's focus on these two. These are the contents of the costal groove: the intercostal vein, the intercostal artery, and the intercostal nerve. Structures from above downwards are vein, artery, nerve, VAN. So nerve supply for all these muscles are the intercostal nerve of their own space. Okay, so that's easy to remember. So what do these muscles do? Okay, why are there so many muscles, and do we have to really know how they act? Yes. If you fix them, they help in elevation of the thoracic cage. But more important than all this description that I have written is the fact that they stiffen their chest wall. The chest wall is held stiff by these muscles. How does that help? It's best understood by actually a problem. So, during normal quiet breathing, you are breathing in about 500 ml of air, out of which 300 to 350 is because diaphragm descends down, and 150 is by stabilizing and expanding the rib cage. Right? Now what happens when the intercostal muscles are paralyzed? Diaphragm is still there. You should be happy breathing. Diaphragm does breathe, help you to breathe. But what it faces is a paradoxical inward movement of the chest wall. So, when the diaphragm goes down, the muscles in the intercostal spaces, because they're paralyzed, they move inwards. And because this flaccid chest wall moves inwards, there is actually very little expansion there to allow for respiration. So, effective tidal volume falls to almost half. Okay. So, this is actually demonstrating what intercostal muscles do. They stiffen the chest wall. So, with this we completed the intercostal space and the muscles there. We still have to discuss nerves, arteries and veins, but I have a question for you. Were you to put in a trocar or a needle into the patient's chest, would you put it along the lower border of the upper rib or the upper border of the lower rib? Upper border of lower rib, of course. Why? Suppose you are operating doing a thoracotomy and you want to peel off the periosteum. Okay? Then would you do that for the upper border of the lower rib or the lower border of the upper rib? Again, the upper border of the lower rib. Why? Because you want to avoid damage to the costal groove along the lower border of the upper rib. Very easy answer, okay? But these are things that are very practical. These are things which are actually applicable in your day-to-day practice later. And that's why we need to know all this, right? So if you're enjoying this lecture, do please like, share and subscribe to my channel and hit that bell icon. Friends, do please visit my website vbanatomy.com. I have a lot of lectures and surgical anatomy videos and MCQs to test your knowledge. There are some wonderful raw and label videos in histology as well. Link is in the description section. I have an appeal for you, my dear friends. I have come out here on YouTube or in any other medium. My effort is to make sure that optimum anatomy education is available to every student worldwide. Okay? It's not excess, it's not below par. But I need to know whether it's really serving the purpose. So please comment in the comment section and let me know whether I'm really being of any use to you. And what else can I do to make your journey in medicine more effective, more enjoyable, and more learned? So I'm looking forward to comments in the comment section, students. Next lecture is about the intercostal nerve, artery and vein. It is also clinically very relevant. Do please watch that as well. Thoracic wall part 2, contents of intercostal space, nerves and blood vessels. So I hope you enjoyed this lecture. I love taking it. Thank you. Bye.